Can you talk more about some of those follow-up services after a hospital stay and how Medicare covers them?
Be glad to do that for you, Adam. I'm so glad you asked because there's a lot of misconceptions around what Medicare, either plan, traditional or Medicare Advantage, will and won't pay for. First, let's talk about a skilled nursing facility. First, I want to break down what is a skilled nursing facility. That means you either need access to nursing care or you need physical therapy, occupational therapy, or speech therapy. That's a difference. Let me stop and break down how is that different from an assisted living facility. Someone can be in an assisted living facility and not need a nurse, PT, OT, or speech. So that's assisted living. Medicare does not pay for that, has never paid for that, will never pay for that. Plan on self-pay for that. But if you have a skilled need, which means you need a nurse, a physical therapist, an occupational therapist, or speech therapist, Medicare will pay for it. In a skilled nursing facility, after you have a 3-day hospital stay at an acute level hospital, the skilled nursing facility that you look at must be certified by Medicare. Here's how the payment works out. From day 1 to day 20, Medicare pays 100%. From day 21 to day 100, you are responsible for a patient copay. In 2025, that amount has been $209.50. So you would be paying that $209.50 per day that you're there from day 21 through day 100. At day 100, Medicare stops paying, so the patient is responsible for any of their days of stay beyond day 100. For a Medicare Advantage plan, they are required by law to provide the same amount of coverage and the same type of coverage as a traditional Medicare. However, the rules and the cost sharing are what makes a difference here. So let's go ahead and dive into that while we're here. One of the biggest differences is that some of the Medicare Advantage programs will waive the 3-day hospital stay requirement. That means you could go from your home to a skilled nursing facility. You don't have to go from a hospital to a skilled nursing facility. Medicare Advantage programs each have their own different rules for when their patient responsibility days kick in. So before you have a skilled nursing facility stay, you'll want to reach out to someone at that program and have them explain it to you in plain language so that you're clear on what the patient responsibility will be for any stay at a skilled nursing facility. One of the more subtle differences is how long a Medicare Advantage plan will pay for at a skilled nursing facility. Technically, it still has to be 100 days. However, their requirement for continuing that payment for stay may be different. The facility may need to get prior authorization on a week-to-week basis, and they may have different criteria by which you stay or pay.